Welcome back, everyone. Tanning beds can certainly offer you a fast all-over tan, but that sun-kissed look can come at a cost. Here to walk us through some of the dangers of tanning beds is Dr. Salem with Salem Oncology Center. Good morning to you, and thank you for joining us. Let's talk about that link between tanning beds and skin cancer. So many young people will hear that, and I remember just being younger myself. It's like, I don't care, I just want to look good. But what can you tell people to really encourage them to be careful?
I think the bed tanning gives a good look for sure, but it gives a lot of trouble because exposure to ultraviolet radiation would damage the skin and would put the individual at a higher risk for melanoma, which is a kind of skin cancer.
And it's a deadly one, potentially deadly.
It is potentially deadly, but what people need to understand is that this is a disease, if detected early, the cure rate is around 99%. It is inevitably deadly when it becomes very advanced. So it's a disease which is extremely difficult to treat when advanced, very easy to cure when it is early.
What is the link between tanning beds and cancer? Because someone might say, well, how can you tell if my damage is just from the sun or if perhaps it is from that tanning bed?
Well, it doesn't make any difference. Any exposure to ultraviolet radiation would put the individual at risk, whether it's from the bed tanning or whether it's from sunlight. Of course, the major source of ultraviolet radiation is sunlight.
Who's at the highest risk here of suffering potential damage and perhaps something very scary like melanoma?
Well, the people who are most highly at risk are people who are white and who had a fair skin, that freckles, who have blue eyes, and also the red-headed people who are white are at highest risk.
So they certainly need to think seriously, perhaps, before they do go out in the sun, or just at least for protection.
The younger you are when you are exposed to ultraviolet radiation, the higher is the risk.
Let's talk about the age limits that they have put on tanning beds. So I believe that it's 16 and a half and younger, you're not allowed to go to the tanning beds at all. 16 and a half to 18, you have to have an in-person parental consent. What is the deal with that 16 and a half? That's a little bit confusing for people.
Well, this is very artificial. I would say that bed tanning per se is something that should be discouraged, and people who would like to be tanned, they need to try to be tanned by other means other than exposure to ultraviolet light.
And if there would be another means, what would you suggest? Perhaps the self-tanners, or even you can go to some of the tanning salons and they have on the spray-on tans.
Sure. I mean, there are several ways where you could get a tan without being exposed to ultraviolet radiation. And that's the key issue.
Let's also talk about, I guess, right now is probably the time when people are starting to think about tan. We're in the middle of the winter, but spring is coming up. Swimsuit is coming up. Do you think it's a pretty prevalent problem? Do we have a lot of young people in those tanning beds right now?
Yeah, sure. You know, it's important to remember that the risk for melanoma has been steadily increasing over the last 25 years. And the most significant rise in America is in Texas because of exposure to sunlight. So my advice to the young is that they should limit exposure to sunlight as minimum as possible, and when they are exposed, they need to use sunscreens.
Dr. Salem, thanks for coming in and talking to us today. It's always just a wake-up call and a good reminder to take better care of ourselves and to remember that tan might not be so important if we have to fight for our lives for
Absolutely.
Good to talk to you.
Health is more important than looks.
There you go. We'll try to remember that one, Chris.